It's obvious. Your muscle, it's your greatest asset as you age, but it's your metabolic bank. So the more muscle you have on your body, the better you balance your blood sugar. It's that simple. The more muscle you have on your body, the quicker your reaction time is. When you go to stumble on a rug or trip on a curb, your reaction time is faster. Your bone density is stronger the more muscle you have on your body. So osteopenia, osteoporosis, right? Diabetes, heart disease. They did a study looking at calf size and heart health. The larger our calf muscles are, the healthier our heart is. That was a correlation study, not a causation. But we know the more muscle we have in our body, the healthier our heart is, the healthier our brain is, the healthier our blood sugar is, and our metabolic health.
Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Deiser. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by Vitamin Lab. I'm your host, Dr. David Deiser, and today on the show, I'm speaking with Kristin Ozha, founder and CEO of Stat Wellness. Kristin started her career as a registered nurse in an emergency department, which is where many of the origin stories in integrative medicine actually begin. People are watching over preventable disease. They walk through the door over and over. We realize that the tools available at that moment are never going to touch the reason that the condition is occurring. She went back for her master's and then her doctor of nursing practice, and then became a family nurse practitioner and a functional medicine certified practitioner through IFM. She's also an ACSM certified personal trainer and group fitness instructor, and that combination is not incidental to how she practices today. It's actually the whole design. Stat Wellness didn't start as a clinic. It started as a boot camp in 2014. The medicine came second. And I think that ordering explains almost everything about what she's built, because most of us do it the other way around. We open a practice, write a plan, we hope the patient finds someone to help them execute the movement half of it, but Kristin actually built the execution first and built the medicine around that. We spent a lot of this conversation discussing how muscle is a clinical priority for her, what it means to take a muscle-first approach with women, and where the gap sits really between what strength programs offer and what women actually want. We also get into the part that doesn't show up in marketing, and that's really what it takes to coordinate a team across a growing organization without flattening everyone into a script. How you get patients generally excited about a mission rather than compliant with a plan, and what it's actually like to lead a mission-driven company in healthcare. During our show, she tells me what STAT stands for now, because it's actually changed. It began as Strength to Achieve Total Wellness, and it's come to mean something a lot bigger than that. Please enjoy our conversation with Kristin Ozha. Welcome to Personalized. I'm your host, Dr. David Deiser. It's so good to be here with Kristin Ozha. How you doing, Kristin?
Great. Thank you so much for having me.
Stat Wellness is the clinic.
Yes.
Tell me what the word stat means.
Yeah. You know, it's funny. Nobody really knows what it means, but it started after I was in the emergency room where everybody wanted everything stat. And so it was a play on words, and it stands for Strength to Achieve Total Wellness. And over the years, it was the whole thing. It was Strength to Achieve Total Wellness. Then it was Stat Wellness. And now people just refer to us as stat. So
Nice.
It's changed a lot.
It's easy to remember. That's for sure. And it's mission driven, right? It sounds like the mission is right in the name. So that was obviously intentional.
Yes. And the play on words comes from, in medicine, when you're in the ER, everything is stat, right? And in the wellness space, it takes time. So it was created to kind of be the opposite. Like everybody wants everything stat, but wellness is a gradual journey. And so I changed the words to be that Strength to Achieve Total Wellness. And now what we're really leaning in on, this is how companies, I feel like, snowball, right? We start with one concept and it keeps changing. But now we're really leaning into more statistics. So it's about knowing your stats. So we really think with all the different wearables, the labs, the data, the in-bodies, the VO2 max, it's like, come to Stat and know your stats.
Yes.
It has changed so many different times. So it can honestly, you can make it whatever you want.
For sure. I read somewhere that your clinic started from a parking lot, a boot camp in a parking lot. Is that true?
Yeah. So actually it was a high school, but yes, we started in a football field at Lassiter High School in Marietta, Georgia. Wow. And it was at 5 o'clock in the morning. And I did a boot camp Monday through Friday at 5 o'clock in the morning before I went to work. and it was called Stat Wellness at the time. And then it's continued to evolve from there to what it is today.
Cool. Amazing. Well, I'm so excited to have you on the show. I want to start with that because a lot of people start with their careers and they don't have a mission-driven focus, right? They don't have, some high-level target they're aiming for or something that's really driving their desire to help people and something that they deeply believe in. And it sounds like yours has been kind of the opposite of what most people do. Like most people go in, they've got like this clinical approach. They're excited to share their clinical approach and follow kind of more of a conventional path. But yours started really at the boot camp stage, right? And then you took that into clinical practice. And I assume you left the conventional approach and started your own clinic from there?
Mm-hmm. Yes. Well, so I started way back as a personal trainer. That is right out of high school into college. I became a personal trainer. I really wanted to quit college. I loved personal training. I loved watching people get stronger than they ever thought possible, accomplishing things they didn't think they could do, even as simple as doing a push-up on their toes for the first time and us high-fiving or being able to do a pull-up, just encouraging and motivating people. I was like, this is what I'm called to do the rest of my life. And my parents were like, can you do it the rest of your life, but could you graduate and finish college? So I was like, fine, I'll finish college, but I don't know what to study. And so my mentors at the time told me to go nursing. They said, you can always fall back on it. Become a nurse, and you could be a nurse at a school, or you could be a nurse at a college or in a hospital. And so I went nursing, and my first rotation was in the dialysis unit. And if any of the listeners know what the dialysis unit looks like, it's fluorescent lights. It's people sitting there getting their blood filtered for 4 hours. They're pretty sick. They don't feel good. It's part of their weekly life to go in and get their blood filtered. And I'm this motivating cheerleader wanting to get them to move and do push-ups. And I was very grateful to have that opportunity, but I quickly saw through my other rotations, what we're really good at doing is we're really good at keeping people alive, and we're really good at sick care. And I'm really grateful for that. I'm grateful to live in a country that has so many medical advancements. We're keeping people alive longer. And so we are seeing our lifespan increase. But I would argue, and I think many people in functional medicine would argue, until recently, there wasn't as much emphasis on our health span. It was all about how long can we live? What tools can we pull in to keep you alive? How can we diagnose illness, diagnose cancer? And so I quickly recognized that I wanted to get on the other side of this. I was very curious. And so after my last rotation in the ER, I ended up loving it because I'm an adrenaline junkie. So I stayed for a year. I kind of treated and treated everybody. I got to see a lot of different things. But at the end of the day, I kept thinking about those people coming in with those 80% modifiable diseases, the strokes, the high blood pressure, the heart attacks, the diabetes, complications. And I was like, I just feel like I'm called to be on the other side. So I went and got my master's, and I actually loved that. I started to be able to think like a nurse practitioner. I was able to sit with my patients. At the time when I was rotating, my preceptors were so happy to throw me in the rooms with their patients for a while because I just sit in there and talk about lifestyle forever. But when you actually go out to practice, you don't have time in a traditional primary care model to just sit there and talk to your patients about lifestyle. When I was a student, I was seeing 2 or 3 of their people while they were going through and doing all the things they needed to do. And so then when I finished, I realized, oh, wow, I only have 7 minutes with this person, and they're coming in once a year. And maybe they don't have diseases, but they're not healthy. And I don't have time to talk to them about that. And now I'm frustrated. So then I went and got my doctorate. And I was like, okay, well, now I've got to go get my doctorate. I got to keep learning. So then I started learning about the gut and how the gut is connected to everything. And Hippocrates said that over 3,000 years ago, all disease begins in the gut. So I did my whole dissertation on that. And I had statistically significant results in my patients' gut health. And it improved their health outside of their gut. It's there's something to this. When you identify what the root cause is, that they have lasting healing. And the whole light bulbs went off that my curious personality, my personal trainer personality was designed for functional medicine. It was designed to understand that our body works as one unit, right? I couldn't go into an environment and write another antibiotic for a sinus infection. I wanted to understand, why are you having your second sinus infection this year? What's the cause? And yes, I could refer to ENT, but ENT is going to scope and they're going to treat the sinus infection. And so then I went to get my certification through IFM, the Institute of Functional Medicine. I started doing A4M residency. And then I started working in functional medicine. And I was like, I love this. But then I quickly found what I had issues with in the functional medicine model. Okay, I'm seeing my patients every 4 months. They're spending a lot of money on labs and supplements. They care about their health. They're super invested. They leave the appointment passionate. But then they don't see results in the first week or 2 or 3, and life gets busy and they fall off and their behaviors go back. And then they are embarrassed to come back in because they didn't do any of the things they said they were going to do. Or they come back in and they're bummed they didn't see improvements and they dropped off. And so I started realizing in the functional medicine space too, like they need more resources. We need this to be a community. I don't want it to be as expensive as it is. I want it to be very personalized. I want it to be very targeted. And so that's what developed into Stat Wellness is I took my background while I was working in these different environments, doing boot camps, doing fitness, to then continuing to grow my medical background, and then being like, there's got to be a way to do both of these under one roof. Have the personal trainers, the physical therapists, the health coaches, the dietitians, the functional medicine under one roof. So then I was like, well, that's what I'm going to do. I'm going to find a space. I'm going to sign a lease. I'm going to start this business. My husband's a 6 on the Enneagram, so he's a loyalist. He sees risk in everything. He's like, well, where's your business plan? Where's your projections? You got to get a loan. How are we going to afford this? And so I go and tour around spaces in Atlanta, and I come home, and I told him I signed a 10-year lease, and it's $8,000 a month. Yes. And my husband's eyeballs are getting so big, and he's like, please tell me you didn't sign a personal guarantee. And I was like, well, of course I did. They're not going to let me sign a lease. I have no business.
Totally.
And so long story short, every bank, every investor, every angel investor, everybody told me no. Nobody believed in it. My husband didn't even think it was going to work. And now he's our COO.
Sweet.
And it does work.
Nice. I love it. Wow. How long has it been?
So we opened in 2019. So we're 7 years old and we're at 8 locations. We have over 12,000 patients and we'll probably be at 100 employees by the end of the year. We're right at the 90 employees right now, including our trainers.
Yes, absolutely. Oh, congratulations. That's so incredible. Why do you think it's such a success?
Well, I think a few things. One, when I opened Stat, I did not focus on our P&L at all. Like I honestly didn't care what the profit and loss was. I didn't care where the business was going. What I cared about was the patient in front of me. I kept asking myself as I was building the model, changing the model, tweaking the model, what is best for the patient? What is best for the patient? And I know many business people are like, that doesn't make any sense. But I knew very quickly from the beginning that the patient is my marketing, the patient is the business. And if I don't focus on the patient experience and what they feel, how they get greeted, the price point, can they stay a patient for life when the economy goes up and down, when a pandemic hits, like this business has to be their place they go. And so we just focused on patient experience. And I think that's what grew our business. And earlier on, there was way less competition. In 2019, the wellness industry was not what it is today in 2026. Mm-hmm. So, now we're having a lot more people reaching out like, hey, we want to do your exact same concept. Will you meet for coffee? Will you tell me how to do it? And I'm always like, I'd love to pull in your entrepreneurial spirit. Would you open a Stat? Because our goal is to grow nationwide and we have no plans of stopping. But I think it's focusing on the patient and letting the business follow.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
If you're a new grad, like a lot of people who watch our show are new grads, people trying to work on their personalized care, like to actually give a better experience, but then also to try to build up their career and get things off the ground. What are the steps that you took in the first couple of years, like 2019, obviously through 2021 must have been a challenging time, like to get this off the ground. What were the steps that you took to make sure the patient experience was optimized?
Mm-hmm. So it really came down to the way the patient was treated. So I always say, like, when it comes to healthcare, it's a very personalized approach. How do we make the person feel safe, cared for, and heard? And the team now that works with us, I'm like, when I hear them, whatever they say about our technology or whatever, I'm like, okay, if you worked with me in 2019 and 2020, and I had hired other people in this time frame, I did not let them bring a laptop into the room. I did not let them wear a smartwatch that was going to ding and like have any patient think they were taking their eye off them and looking at a screen, looking at a watch. And then this day in technology, I mean, this is 2019. It's not that long ago. They had a notebook and they sat there with the patients with a notebook and a pen and they looked at them in the eye and they wrote everything down. As we've grown, I've realized that's like not realistic, because then they had to go home and they had to type everything from an entire day. Like, it didn't make sense. But it's an example of what I needed the patient to know they were the priority. When they walked in the door, they needed to be greeted. They need to be smiled at. They need to be like, we need to pay more for our front desk. We need to make sure that our team's not on laptops, on technology, that our patients know. So for us, that personalized connection and creating a third space for people, somewhere that's not work, that's not home, where they got to feel a part of something. And, keep in mind our first location, when you walk in, you don't think you're in a medical practice. It's a gym. You see barbells, you see rubber floors, you see floor to ceiling windows. And when we first opened doors, everybody walked in and they're like, oh, am I at the wrong place? I'm here for a functional medicine appointment. And no, like the waiting room's right there inside the gym. So you can look at people lifting weight, working out, and you're sitting there, right? Mm-hmm. So I think we've said a few things since we've opened doors that I feel like is important. You eat with your eyes first. So we care a lot about our space. We care a lot about how it feels, how it looks. Every one of our 8 locations looks very different. We do not have a traditional square foot size. We do not have a traditional building. We want to fit into the community we're in. So if you guys are familiar with Roswell, Georgia, it's very historic. We're in an 1850s mill house. West Midtown's very industrial. We're in a concrete box with floor to ceiling windows, exposed pipes, right? Mm-hmm. That is 2 very different businesses, but you feel part of the community. You feel that third space. So we always said from the beginning, you eat with your eyes first. That's very different than most medical practices think. So we cared a lot about aesthetics. And then we want to now create a space where you feel safe. You don't feel judged, no matter what. Like, I may think you need to live your life slightly different, but like, I'm partnering with you. I'm not here to judge you. You've got 3 young kids and you're stressed out and you're going through Chick-fil-A 4 times a week. Hey, that's life right now. Let's talk about how do we get some nutrients in for breakfast. Let's talk about some easy places we can get salads to bring with us to work, right? So I think those were really important to our success early on, but that's not necessarily all the listeners why. That's not the experience they want their people to have, or maybe they don't feel comfortable to take the leap of faith. I couldn't pay myself for 3 years. So when people hear my story, I'm like, we literally sold our house. I lived on my sister's floor. This is not glamorous. This is messy. Yeah. So maybe everybody's they're not able to take that risk, which I recognize. But I think what's so critical in anybody that's wanting to start a business, what is your why and what do you want your patient to feel and say about you? Because they are going to talk about you. That's your reputation. So I would really encourage you, like, what is your why and what do you want the patient to think and feel when they come into your space? And that needs to be your foundation before you think about, okay, well, where do I do marketing? And how do I increase my profit? Because if you do marketing, but you don't have a space that your patients feel safe in, or you don't have a flow that makes them feel seen and heard, you're going to be trying to acquire a lot of new patients. And that's hard. Mm-hmm.
Completely. So you've brought up so many great things here. So far within our chat, you've talked about this connection, right? Like what happens in the first few minutes. You've talked about the space and people feeling comfortable. But you did make a comment earlier about those first 2 to 3 weeks, people falling off track in old models. Mm-hmm. How does your model ensure some wins? Like, how do we make sure that people are feeling like, okay, this is something now I'm doubling down, like I'm actually going to commit to this. I'm seeing something change. What is that something? What is your tracking? What do the first couple of weeks look like in your model?
So my favorite saying in my whole podcast is based on this too. It's little by. So it's little by little, little becomes a lot. That is our ethos at Stat Wellness. We want patients for life. We want to help them make small, simple changes that over time are going to transform their life. I do not want to give you some earth-shattering diagnosis and like one pill that's going to save your life, because we all know that's not going to last for the rest of your life, right? So we're very clear on our treatment approach, and it's lifestyle first. And we sprinkle in supplements and hormones and peptides and all those things, but it's a lifestyle medicine first approach. So what does that look like when you come into Stat? We identify some areas that we need to optimize in our life, and then we get you in. If you're a member of Stat, you get unlimited health coaching and unlimited dietitian visits. And at the beginning, if you're new on this journey, you may need to meet with the health coach every single week. And you can meet with that health coach every single week, and you can bite it off slowly. You can feel accomplished, like you're doing something. Like, okay, this week, all I'm focusing on is going to bed a little bit earlier. I know Kristin wants me in bed by 10, but I'm going to bed at 1. So we're going to meet in the middle, and I'm going to go to bed between 11:30 and midnight. We're going to celebrate that person that started going to bed between 11:30 and midnight. That is going to make a difference in their health over time. So that's an example of how We really want it to be bite-sized. We really want it to be actionable, and we really want you to have the resources. And the movement side, when we only had one location, it was really different because I got to see my patients come in to work out. I was only working in one space in Atlanta. I was seeing all my patients on the medical side, and I was watching them come and strength train. And that was what the business was based on, is I want to see you come in and put in the work. I want to see you strength train. I want to give you the resources to help keep you accountable in between our visits. So I still see my patients every 4 months or so, the same as my previous model. The difference is you can come and work out in our space. You can meet with the health coach, the dietitian. They're going to call me when we're getting off track. When you're having a side effect to a supplement, I'm going to know, and we're going to tweak, right? And so I think that is what has helped kind of with how we view healthcare, this kind of modern health approach, is there's so many touch points, right? This is a lifestyle, it's a community, it's collaborative. We have physical therapy. We put it all into our membership models, and we don't want you to feel like every time you meet with a health coach, when you need more support, you have to pull out your wallet and pay for another health coach, another health coach, another health coach. It's like, meet with them every single week. You'll get to a point where you need them once a month, but you have the resources to do either.
Super smart. Were you in this subscription model initially? Like, did you start with 2019 the same way?
Yes. Yeah, and we do a la carte still. So the bulk of our patients are a la carte. Like, they pay to come in because some of our patients are so focused. They're, so health literate, I like to describe it now, that some of them are like, I'm just going to come in 4 times a year and do some detailed labs. You tell me what to do. I'm so disciplined. I got it. And so I'll tell you the solution we have for them because we've been able to pool them into a membership. It just wasn't our traditional. So when we first opened in 2019, we only had one membership, and it was medicine and movement. And it was everything included that I described in our Atlanta office. And we quickly found on the medicine side, we have patients fly in, we have patients drive in, we have patients all over. They're only going to work out at our gym with Atlanta traffic if they live within 5-mile radius. Even if they live 6 miles away, 10 miles away, they're going to go to a closer gym, or they're not going to do it because of traffic and driving 40 minutes to and from 3 times a week. They're not going to do it. So then we realized, okay, we need to have the medicine and movement membership, which is our bread and butter, but we need to add a medicine only membership for those that don't utilize the gym. They have their own gym at home. They have their own situation. So we created a medicine membership. Then we started recognizing some people, they really weren't interested in functional medicine. They just wanted to come and build muscle. And that is what we started as and what we are. We're a true strength training gym. It is 55 minutes of strength training with good recovery in between reps. It's designed by a physical therapist. It's very different than how people are used to working out in a group fitness setting. So we created a movement only. So then we had medicine and movement. And those were our only memberships. Well, then we started recognizing, okay, well, our patients are moving to a la carte year 2 or 3 because they don't need the health coaching and the dietitian anymore. They feel like they're eating well. They've nailed down the lifestyle. They're feeling so good. So then the last thing we pulled in is what we call our custom membership. So like, well, okay, now let's get into some of the fun, cool, exciting cherry on top stuff. Let's blend in the peptides, the IVs, the injections, the VO2 max, the RMR. Let's get you wearing a continuous glucose monitor and get more specific with your macros. So once those lifestyle foundations are in place, then you can customize your own journey for $195 a month with us. And we create what you need at that point in your life. So again, same way our stat name has changed, our membership models have changed. We're listening to our members a lot, our patients a lot, we're tweaking. We're dynamic, and we still consider ourselves a very small business. And so, in the startup small business world, like, you got to be pliable.
Mm-hmm. Yeah, you do. It sounds like you're very adaptable and focusing on the patient experience, right? And letting that drive the adaptations that you have. I love it. It's so cool. It sounds like the ethos is so important to you. Already we've talked about like the value being in the name. We've talked about how important community is and that connection piece. This is a very practical question, but do you post your values? Do you post your models? Do you have signs? Like, what's your onboarding process like for both patient and employee? Can you tell me a little bit about that? I've got a couple of clinics and we have models, but explaining those models and the path to people, it's not the easiest thing. It can take so much time. What is your kind of hack to this?
Yes. So internally, we have different culture and like team values than we do external. And I've had a lot of people come in and say, like, you can only have one set of core values. And I personally totally disagree with that. I think we have team core values and patient values that are different. And we lean in on that. So on a culture fit, on a team fit, we have really clearly identified our core values. We know the type of person that's going to thrive in our environment. And so when we interview at any different level, we talk about what our core values are and make sure that they feel that those are a fit. So, one of our core values is ego is the enemy. If we hire anyone that comes in that has an ego, it really sticks out in our culture. Our team doesn't like it. They don't like the way it makes them feel. They stand out. Like, if you're part of our company and you see trash needs to go out, you take trash out, right? Like, I always talk about we should technically flip our organizational chart. Like, my job as a leader is to make their job better. So that's like a very big thing. We also have some unsexy core values like relentless customer service. The word relentless, like, that sounds exhausting, right? Like, that word is like, whew, relentless. But it is. Like, it's relentless customer service. Going above and beyond is our standard. It's not like, ooh, this employee went above and beyond. It's like our expectation is every single person on the team goes above and beyond. So if you just do a good job, it stands out. You got to do a great job when you're part of SAT, or you feel it. And like this growth mindset part. So we like culturally really have a lot of clarity on like who we hire, what the expectations are. So when we talk about it and like, they're like, well, I did do my job. I answered the phone. And I was like, you did. But like, you didn't say hello and greet that person by name that walked in the door. And like, that's our standard, is that the person that walks through the door gets a smile, gets greeted by name. And they recognize when we hire someone new, if they're on the phone and they don't look up, they call me. My patients will call me and say, hey, just a heads up. Like, we know you're growing. The person didn't look up from their phone. I'm like, well, that's a lot on the front and we recognize it, but it's our culture. It's kind of what our patients expect. So we're very clear on the unglamorous pieces of coming to work at STAT, but then also the culture, the fun, the support, and the teamwork you get. On the patient side, a big thing, and we're actually in the process of doing this, we're doing a rebrand and a new website, and we just got our family photos done. But we're putting in a frame our family photos, we're putting our origin story, our why, and our STAT promise. We got really clear on what is our STAT promise, and my email is on all of those. That is about to go up in all of our waiting rooms, because I do feel like as you grow, it is harder and harder for a patient in an office I never work at to know who I am as a person. And so we are going to be putting that in every single waiting room in a frame to really lean in on what is our expectation when you come to STAT? What is our expectation that you feel and experience? And if you get anything less than that, send me an email. And I talk to all of our customer service issues. I believe that's an opportunity to learn and to improve. And so I call all of them whenever I'm aware of them. So I think that's like what we're doing on the other side. And we're also, when everybody's going digital, we're going to like printed folders as well that we're about to do in this launch. So I like to break the boundaries and do the opposite of what everybody's doing. So when everybody's going telemedicine and automating and AI, I'm like, how do we not do that? How do we get more folders, more printed schedules, more STAT promise out, my personal email, the origin story. And we do corporate-wide Zooms on a quarterly basis. And this allows us to also remind everybody of who we are as a company. Every single employee, every single quarter, we start with like who we are as a company, and we're so happy you're here. How's each department doing and living out our culture and values? So I think there's a lot of intention that goes behind the culture and the hiring and then communicating with patients. But I describe this too, and I've been on a lot of podcasts talking about this, is like I describe parenting and running a business as very similar for anybody that has kids. I have 3. And you've got the infancy years where I had like one location where you're like physically exhausted. You're working from 3 to 11, right? Like you're just up all the time. I was teaching fitness classes, drawing labs, doing IVs, seeing the functional medicine, answering the phone. I couldn't pay for anybody but Sarah Rose, who's still with me. It was me and Sarah Rose. And now 7 years later, it's like Sarah Rose is still such our right hand. But that you're physically exhausted, but you can control everything. It's not as emotionally hard, right? And then as you grow, you get to the toddler phase where you open your second location and you're kind of wobbling. You're like, well, I can't be in both places. You're testing your systems and your operations, right? Then you get to like, we opened our third. We're like, oh, we've opened 2. We know what we're doing with multi-site. We open our third. It's all Metro Atlanta. We're kind of in those golden years of like the 5 to 10-year-old that you never hear about. They just like love their parents. It's just like a really, like, it's manageable. It looks good. It feels good. The feedback's great. Our numbers are great. We have brand awareness, right? And then we got to adolescence. We opened up last year Nashville, our largest location, and we opened up Charlotte last week. And so we've got these new larger markets, these larger build outs, these like paying for a lot of non-revenue generating lounges, right? We're continuing to build and adapt. We're in adolescence. We're like, okay, wow, we've got some acne on our face. Turns out like when you go to a new market that doesn't know who you are, you got to do some marketing. You got to do some community outreach. And I'm not there to go knock on everybody's door the way I did with Atlanta. And so I'm always transparent. I'm like, I'll have more for you, like maybe in a year or two, if you ever have me back on the podcast, because we're in the messy middle. We're trying to figure out a lot of that. And so those are the things that we're doing right now to make sure everybody knows our origin story and that like campfire story resonate. But yeah, the messy middle, the adolescence, I'm like less physically tired, more mentally tired.
For sure. For sure. I hear you. I'm kind of looking forward to that phase. I'm still in the toddler phase. I'm physically tired with 2 locations.
Yes, you're wobbling. It's that. It's a lot. Yeah. And then the emotional piece comes when you just like, you have 100 employees. Like you have people with all different personalities, all different work ethics, all different Enneagrams. Like, you've got leadership that's grown with you that you're trying to continue to pour into. You're one person. You got, it's just, you can't bottleneck your company when you have 8 locations anymore. You've got to hand things off and you got to be okay with it.
Definitely. For the practitioner watching, we've got nurse practitioners watching now. We've got medical doctors, naturopathic doctors, all in the functional medicine space. Most people are not running clinics, right? Most people are one person, either associate or running a smaller practice than you. I think the thing to gather from this, from both infancy and toddler phase, is really the ethos that but the values that you fall back on, both for your team and for your patients. And I bet you that it has been so valuable. I just picture myself as, kind of being a patient and coming into our practice where we don't have things posted, right? Like you have to like literally dig to find out our origin story. How much value would be there if we actually did some of that? And I'm typically trying to encourage my team to share their story. Like, why did you get into this? But it sounds like in your recruiting process, you have discussed this and gone through and made sure people are the right fit. How do you find people that have that relentless quality or are accepting of the relentless quality? Like, do people find you or are you out there headhunting?
Yeah, most find us. Our best hires have either been our patients and they love, like they've been involved, they've seen the journey, they've watched the growth, and they just want to be a part of it. And they're phenomenal employees because they've experienced everything themselves. Sure. They know how to talk about it on every single level. So a lot of our staff was patients first, which is kind of fun. And they still use our services. And to me, I'm like, that speaks volumes when a patient in a system wants to work at a medical practice. And then we hire a lot of referrals from our staff. So one of our questions when we do anonymous surveys is like, would you recommend your family and friends to work at STAT? And we usually come back with a 9.5. Very few outliers of like a 9, but almost everybody is a 10 out of 10, like they would recommend. And so that is also fantastic because those are the best hires. When you hire someone that has never experienced your business, they know nothing about what you do, and they don't know any of our employees, it's taken a little bit more time to get them to understand who we are. But obviously, when you have 8 locations, like we've hired a lot of people that we have not known. And many of the listeners have probably heard this saying, but I really do believe it's worth repeating that it's like, be slow to hire and quick to fire, especially if you are someone that has one single location and you have a team of 3. If one of your employees is not stellar, that is incredibly toxic when you have 3 people working together, right? So, sometimes as business owners, like we have to make really difficult decisions and let go people that are good people, but in the wrong role. And it's absolutely my least favorite thing of running a business is making those decisions. But your company is only as good as your staff. And that's if you have one person, that's if you have a virtual assistant, it doesn't matter. It is your company is only as good as your people. And if your people hate their job, your patients know. Like it is, you can't hide it, right? So I really think about that a lot. And that's the things that I've never actually lost sleep over the business, which is funny. My head hits a pillow and I pass out. So I'm sorry for any of the listeners that your mind's racing with 100 zillion things. Yeah, I always joke that's my superpower. I wake up refueled because I have to, right? There's always chaos. There's always fires. You have to take care of yourself as a business owner. But those are the hardest things is the people situations. And so the clearer you can get on your core values, what kind of culture you want, put it on paper, identify what that looks like, give very specific examples, and don't try to sugarcoat positions. So like our nurse practitioners, and one of our newest hires right now, there was 2 things she said that I just loved. One, she was like, I'm absolutely drowning. I've never been more stressed in my entire life. But you explained every single one of these. I would be drinking from a fire hydrant. I'd feel like I'm in school again. I'm going to be researching and listening to podcasts and reading on the beach. Like you did not sugarcoat it. So I knew what I was getting into, and I'm so grateful for the opportunity, but I'm drowning, right? And I can tell her at 1 year, you're going to be comfortable. At 2 years, you're going to be confident. It's going to take that long, right? And I tell people that. So when you're hiring for whatever role it is, be clear on the culture you want, the core values you want, and also tell them about the good things and the bad things about the role. Yeah. Because when you deal with people, you guys are listening, you're medical providers, you deal with clients, you deal with patients. A B to C model is extremely challenging. It's a hard model. There is a lot of emotion in it. This is people spending their own cash to hear what you have to say, right? They're making lifestyle changes. Some people come in thinking that we're just going to all of a sudden change their entire life right away. Yeah, there's a lot of pressure. And so you just want to hire the right people that understand that. I used to want to try to kind of downgrade some of the struggles of a consumer-based business and how busy we are. And when I did that, I realized I didn't really hire the right person because I was I didn't paint the right story. Right. So I think that's really important.
Yeah, super important. Super important. Just to kind of close up this chapter about career development and clinic development, I'd love to hear a little more about the model. Just because we don't have this kind of subscription-based functional medicine model really in our city. It exists to a certain extent, but not very many clinics use this. And I can see some of the advantages and disadvantages, but I'd love to hear from your world what some of the advantages you see and disadvantages, if you don't mind.
Mm-hmm. The biggest advantage, from a business perspective for your listeners that own a clinic, is you can expect certain revenue, right? If you have 100 members at $185, you're getting $18,500 a month, right? Mm-hmm. You can go on vacation, what you're getting per month. It's recurrent, right? Yeah. I think that's a really big positive when you're a business owner to have that recurrent revenue. Another struggle for us is we have so many people that go out on maternity leave. So they're gone for 8 weeks, they're gone for 4 months, whatever they take. And that's lost revenue, right? And very challenging if you own a medical practice and you make your money from a provider seeing a patient, right? So those are some of the pros. I think also from the patient perspective, the pro is what I was talking about before. They know what they're paying and they know what they're getting. And so they don't feel like they have to save up or have enough in the HSA, or I didn't realize I was going to need 5 meetings with the dietitian. I didn't realize that I was going to be seeing you again in 3 months. I thought this was a once a year investment. And now I have to keep coming. I can't keep affording this. There's a lot more transparency. This is what you pay and this is what you get. And you can use more or less. It's available. So I think that's all really, really great. I think some of the cons, and we actually did not experience this until our Nashville office, because we have a split between members and a la carte, and our a la carte fees are actually much higher than our membership fees. So when we opened Nashville, our only revenue has come from memberships, and our overhead's really high, and we've never had that happen. They're doing a great job. They have over 200 members. They continue to grow, but every single person is a member. And so we don't have people coming and meeting with the dietitian and paying $199, or meeting with the physical therapist and paying $199. So you want to make sure, if you're going to do a solely membership-based model, how many members do you need to make the revenue you want? Because for us being such a hybrid model, we didn't account for the scenario of, wow, we only have members, which is great, but our price point has not been determined by 100% member-based practice. So I think those are some of the biggest pros and cons that come to mind. And now, your patients can use HSAs too. So being able to use an HSA on a membership, have it be very clear on what they get, and have the recurrent revenue for you as an owner to be able to expect is amazing.
Yeah, that's so cool. And I can see as the practitioner that a little bit of freedom in just knowing that, you've been paid. Now, communicating with the person, having them chat with the health coach, getting feedback from the health coach, that kind of collaborative care can be so much easier when you're not worried about, hey, I spent 5 minutes here, 10 minutes here, I need to bill for this, I need to bill for that. Because that can be exhausting, thinking about all that and making sure that your value is being accounted for. The membership model would just be so nice. I feel like it would be very freeing for someone like me who's always trying to give more, just trying to give more. It's so nice to have something like that. Unfortunately, it's not really permitted in our province, in my profession anyways. It's not really permitted. So it's really tough.
Are you in Canada?
Yeah, I'm in British Columbia as a naturopathic doctor. And And basically, you're not supposed to have a model where people are prepaying for consultations.
So it's funny because we're talking with another company and looking at coming to Canada. I would love to open up in Canada. And there is some loopholes because you could be a movement, you can be a gym, and then you could charge for your functional medicine visits because we're talking through that and looking at all of that. And I just got aware of your guys' laws and regulations. They are different than the US.
Definitely. Yeah, definitely. It's a great idea, though. So I want to transition. It's actually a really good transition. I want to talk about personalized care and you being muscle focused from a foundational point like 2019, muscle focused, building your clinic from that. And I know I get the evolution into this new version of STAT, and I'm obsessed with it. And you probably know that I'm obsessed with VO2 max, and it's like my whole life. And I just love fitness assessments and helping people optimize their training. Tell me about your drive to be initially muscle focused and really, tell me a little bit about how you've made it a clinical priority for your patients rather than sort of like a lifestyle design.
Yeah.
How did that come about? Obviously, you were a personal trainer, but give me the importance of it, really.
Yeah, it's funny. My thinking is so black and white on this when I talk to people, and I recognize not everybody's thinking is as black and white as mine is. But when I first was looking at this model to open in 2019, it was so clear the only way to get my patients to live longer, healthier lives was to maintain muscle as they aged. Like, I have that black and white thinking. If you want to live a long, full life of independence, you have to maintain muscle. Like, I will stand behind that today in 2026. I think the world is catching up a lot more with my black and white thinking. Fitness is not aesthetic anymore. It's functional, it's longevity. It's, you look at someone that's strong and you see youthfulness and independence, and people at 80 are starting to lift weight for the first time in their life, right? Our oldest personal training client is 96 years old at STAT. And that man is going to be a centenarian because he is coming in and meeting with the trainer and lifting weight at 96 years old. So why do I feel so black and white about this? Like, to me, it's obvious. Your muscle, it's your greatest asset as you age, but it's your metabolic bank. So the more muscle you have on your body, the better you balance your blood sugar. Like, it's that simple. The more muscle you have on your body, the quicker your reaction time is. When you go to stumble on a rug or trip on a curb, your reaction time is faster. Your bone density is stronger the more muscle you have on your body. So osteopenia, osteoporosis, right? Diabetes, heart disease. They did a study looking at calf size and heart health. The larger our calf muscles are, the healthier our heart is. That was a correlation study, not a causation. But we know the more muscle we have on our body, the healthier our heart is, the healthier our brain is, the healthier our blood sugar is, and our metabolic health. And it's very easy to measure it when you have a body composition tool on site. And so it became so clear to me, okay, we test your muscle mass. You're at 80% of the muscle mass you need. I get you to 100% of the muscle mass that you need. You're going to live longer, assuming that nothing tragic happens to you. But from like a chronic disease perspective, you will live longer if you have more muscle on your body. It was the only way I thought. And so it's funny because when I opened, I was like, again, black and white thinking, doing true strength training. People were coming in and they did not in 2019 understand this concept. They didn't understand me telling them to take a minute break in between squats. They looked at me like I had like 8 heads. They were like, do you want me to do burpees? Should I go sprint up the hill outside? And I was like, no, I want you to rest so you can lift heavier, so you can build more muscle, so you can live longer. And there was so much knowledge and education that needed to go into that at the beginning, where it's like now the world is kind of catching up. People are talking about muscle. I think we've kind of over-proteined everybody, but protein and creatine, everybody I think knows that they need protein and creatine, but they also need carbs, I will add in. But I think the world is catching up to that message, but at the beginning in 2019, it wasn't there. But yeah, it was very black and white thinking on my part.
Love it. Yeah. I'm sorry with you. I come from an athletic background and just remember being, in my late teens, early 20s and just looking at the crowd of people that I was around who was in their 40s and 50s and 60s and just like having that thought like, okay, that person's going to live a long time. Oh, they're going to be strong at 80. And then seeing people who haven't done that type of training and just understanding the risk that they're going to have and maybe seeing a fracture at 50 or, maybe seeing diabetes or something show up before the age of 50 or before 55. Like it just seemed so rational to me that the athletes were having a better chance at that health span, but we didn't have a term for it back then. We didn't really call it health span. So when you're communicating this, are you using that term? How are you communicating the value? Because I'm sure that you see a lot of people, I'm sure people come to you who have never lifted before, even now, even knowing your background. How do you communicate the value to them? Do you use the term health span, for example?
We do. We use the term health span, but we also, every single new patient that comes in gets a body scan. And so we have that information and it puts it down to percentages, as I was mentioning earlier. So it's an easy segue because I tell what's great about our functional medicine providers, they don't have to do it all in their meeting, right? Like they don't have to be the health coach, the dietitian, the personal trainer, the physical therapist. Like we have all of it under our roof. So if someone comes in and their muscle mass isn't 100%, we can say, hey, we want your muscle mass to be at 100%. I'd like to get you booked for a free 15-minute consult with our director of movement and like place you in what's going to help you get to 100% of that muscle mass you need. So we really just identify it and talk about why it's important. And then we get to have them work with our collaborative team, which is great. Because a lot of the listeners, you're probably like, well, how am I supposed to talk to them about their strength training and their muscle and how they're eating? And if you have a single practitioner, like it's very challenging. But you can even have community partnerships, like where, maybe you don't have all of it under one roof, but you can have like the personal trainer in the community that you love, that you support, and be like, hey, I really think we need to get some strength training. I have a personal trainer. I trust the way that they treat their clients. I'd like to refer you to them and really focus on building muscle. Then you focus on what you focus on. I'm going to focus on your nutrients and your gut microbiome and your urine hormone test, right? Like it is very hard. And I tell our functional medicine providers, you can't be every specialist in the room for that patient. You just need to know how to create that holistic experience for them within the community you have.
Right. So as part of that holistic experience on the muscle building side, is it sort of a same program, a same method for each person when they are, say, referred for the group training or for the health coaching guidance? Like, who decides on the plan and how is that plan built out and communicated?
So we always say our nurse practitioners or our functional medicine providers are the quarterback. So they're the one that's personalizing a plan for all their patients. Because of the complexity of our model, some people just come in for group fitness and they've never done anything else, or they just come in from ClassPass. And so our group fitness at all of our locations on Monday, they're all doing the same workout. On Tuesday, they're all doing the same workout. We do upper body, lower body, total body, upper body, lower body, total body, right? So that's very the same and every single person does it. And it's all focused on strength training and it's all created by a doctor of physical therapy. So we have that. But then when it comes down to like, okay, are you ready for group fitness? You have right shoulder pain and you were told you can never deadlift. Like that's my biggest pet peeve in my entire life, that they can never deadlift. I'm like, okay, well, you bent over and picked up your purse after we met. I just watched you do a deadlift. So if you can never deadlift, you are absolutely going to throw your back out picking up a random thing because you have to bend over and pick things up. Or the person that I can never do an overhead press. Okay, do you ever grab anything above your head? The grocery store, in your closet, do you ever grab anything above your head? That's a press. That's a shoulder press, an overhead press. So, does it mean that we need to max out and do 1 rep maxes or 3 rep maxes? No, that doesn't need to be our goal depending on what's going on with the person in front of us. But to us, that's a functional movement pattern that if we live in this space where I can never do that functional movement pattern, you're hindering your longevity and you're going to injure yourself. So that person may need to meet with the physical therapist first and really help to work on the issue, the pain, the dry needling, the cupping, the blood flow restriction therapy, all the things that we do there. And then they get to graduate to a personal trainer. And then they get to graduate to group fitness, right? The journey's not the same for everybody at STAT. We're all unique. We're all different. We like to say our functional medicine providers, they should know your entire history, everything. They're going to be your quarterback. They're going to help you navigate all of the services we offer because it can be complex. But if you don't have issues and you just want to jump in and do something, you want to meet with a nutritionist and clean up your diet, you can. You want to come in and do some group fitness, you can. But when you follow our whole journey, it's going to be very personalized from the functional medicine perspective.
Right. Say you're someone and you're just getting into this world and you're trying to, develop a program or develop a mindset for your patients around muscle. What is the tracking tool? Are you using InBody? And how often are you tracking for people? Do you have a method or some special way of following them?
So we do the InBody. And the reason we do it is because it doesn't have radiation like a DEXA scan. And so when you're doing as many as we are in our space for our staff, we do the InBody. And in research, it's very close. It's like decimal points off. So we've been very happy with it. So we really love the InBody scan. how often we track it depends on the person and what's going on with them. We suggest at least quarterly doing it. For most people, quarterly is a great segue to see like, okay, you're starting to lift heavier, you're eating good protein, you're carbing after you work out to help push the glycogen back into those muscles that you tore down, right? Like we talk about the importance of protein and carbohydrates in the strength training space. Maybe we do add creatine, maybe we do add amino acids. It just depends on the person. But quarterly, we suggest everybody do it. And we don't care about the number on the scale at all. I don't even like to talk about it because it's the muscle mass and the visceral fat. And then I would say the body fat does matter to a degree, but the number on the scale does not at all. So once a quarter, we're going to look at that and we're going to help to tweak things, focusing on body recomposition, as we like to call it. We don't like to say weight loss because that's not really the goal. So we do that. But there are situations, like we do low dose GLP-1s in people that need it. And I might do body scans once a month because if you lose any muscle, I'm actually not lengthening your life with the GLP-1. I'm hindering your longevity, right? If we're just losing weight on a GLP-1, that's not healthy. If we're losing 10 pounds and 5 pounds is muscle, that's not healthy. So we may do it once a month when we first start a low dose of GLP-1 to help them, because we've seen really great success in the Alzheimer's space and the cardiovascular space and the autoimmune fertility. Like we've had a lot of positives, but you don't want to do something that's negatively impacting the goal of muscle building. So those are some examples. Or, let's say somebody is starting something new, like they started testosterone, they're menopausal, they've been trying to build muscle, they've been strength training for a while and it's not helping. We may, in 6 weeks, start them on some testosterone and see if they're building muscle. So we can always do it more often, but quarterly is more standard for us.
When you're setting up goals for people, let's say in our practice, we have a couple InBodies as well. It's our favorite tool too. And we see a lot of people who have a muscle mass below kind of the 100th percentile. And we try to set goals, but I find the goal setting process to be quite challenging. Can you tell me about your goal setting process? Is it sort of a percentage muscle increase over time? Is it a certain number of pounds of muscle? How do you gauge that? And how do you set people up for success?
Yeah, I think this is where even in our team, everybody has different thoughts on what goals should be for people. My goal is very simple. You're building muscle, you're winning. So as long as we're moving up, like if I haven't done a body scan in 3 months and you gain 2 pounds of muscle, I'm still celebrating that. We're building muscle. So building muscle, it's an organ. Like it takes a lot of work. It takes good nutrition. It takes good strength training. So my celebration and goal is just any muscle mass is worth celebrating and keep that as the focus. Some of our team thinks that it's more reasonable to have more specific, like 10% goals and things like that within that 3-month period. But if somebody's starting out and they have 60 pounds of muscle, in 3 months, that's going to 66 pounds of muscle. And that is great. But, the older you are, the less you've strength trained, the harder it is to go in and lift the weight that you need to build that kind of muscle. So I know it's not as black and white there, but to me, what's black and white is if you're gaining muscle, you're doing great.
Yeah, you're doing well.
Yeah.
I love that. That's smart. Yeah, that's super smart. And there's often newbie gains. Like, so, I'm sure that a lot of people come to you, never lifted before, and you have this conversation and you get some gain. And then in the second round, people plateau.
Yes.
And it starts to feel like, hey, I'm doing all this work. I'm doing all the right things. I'm taking your supplements and following your nutrition, showing up for your classes, and I'm plateaued on muscle. How is that conversation for you? Like, how does that go?
Yeah, so we want to see, like, one, if they're doing true progressive overload and they are continuing to lift heavier weight and not building muscle, then we look at what is the other things going on. Like, is it our diet? Are we under fueling? Are we not getting enough deep sleep to build that muscle? Is our growth hormone low? Is our testosterone low? So we're going to look at the root cause, but sometimes they're just not progressive overloading. So they have the gains at the beginning, and then I talk with them and they're still lifting the exact same weight they were in January, and we're in November. So yeah, I mean, you're doing muscle endurance, which is great. I'm glad you're still lifting weight. I'm glad you're still working out. I'm glad you're engaging your muscles, still helping with the blood sugar and the blood pressure, and you're getting movement, but you're lifting the same weight 11 months later. You have to have progressive overload. And there are periods where people don't feel like they can safely lift more. They're like, this is kind of the max. Well, then you have to change the tempo of your exercises. So like instead of doing a squat that's 1-1, you may need to go down for 2 counts and hold for 1 and come up for 2 counts. That's going to put more load on the muscles, even if your weight's the same. So you have to change, like something has to change. So I always ask those people that have plateaued, well, how are you exercising? When you say that you plateaued, are you lifting the same weight? Have you changed your workouts? And if they're like, yes, I'm like getting stronger and stronger. I've like almost doubled my weight. I was doing 15-pound bicep curls in January. I'm doing 30 now. then I'm like, okay, well, we need to dig deeper. Like, let's go through what you're eating. Let's look at your hormones. Let's look at your growth factor. And that's where we'll start to do some peptides and testosterone because we believe in those too, right? Like we'll pull in those tools. But in my experience, what I have learned, and this is more generalized for women, every female, when I watch them lift weight, almost always, I'm like, let's put 5 more pounds on. Their form is perfect. Almost every female can lift 5 more pounds than they think they can. So if you are listening, this is probably true for men too, but I definitely see it in my female population. They're like, no, that weight felt really good. And I'm like, your form is perfect. I want to try 5 more pounds. Their form is the exact same, and they did a great job. So I think we can do more than we think we can once we know we have really good, safe form. And I've learned over the years that my patients, like, I get really specific with them when they're like, I strength train 3 times a week. I'm like, okay, that's amazing. Tell me, what does strength training look like? How many reps are you doing? How much pounds are you lifting? It's funny, like, as I speak about this in 2019, they would tell me they strength train 3 times a week, and I'd like check it off. Like, oh, great, they strength train, right?
Nice.
And the longer and longer you do it, you're like, oh, they think strength training is their 5 and 10 pound dumbbells at their house.
Right.
So now I need to get them in. Maybe they can't meet with us regularly, but I need to get them on a movement app, consult with our physical therapist, help identify what is like a healthy weight for them to lift. Because there's a lot of misconceptions on what is strength training.
Yeah, completely. I'm glad you said that. People don't think about that enough when they're working with their patients. Just getting into the details, and we have the time. We should be able to get into that type of detail. And one of the details that has been coming up for me a lot in my community, Vancouver is just like the coolest place because it's like the fittest place in the world. People have transitioned from CrossFit to F45 and now into High Rocks, and the whole community is involved. And the sessions are insanely intense, right? Like they're super intense. The actual competitions are really long. Like it's tough. It's hybrid movement. And one thing I'm struggling with, and I find a little bit challenging, is this balance between what is hypertrophy, what is you focusing on that muscle organ and taking that seriously, and really what is overtraining. I used to think like it's so difficult for people to overtrain. Like you really have to. It can be quite punishing. But now, since of my 9,000 patients, like 8,500 of them are female. And right. And I'm like, want to be their expert go-to. Finding that balance between what is proper hypertrophy versus, for this crew especially, what is overtraining. Finding that a little challenging. Do you have any signals that I could look to? Any way of figuring out? Okay, we've done too much.
So I would argue that it's never just the way they're training that's leading them to overtraining. Like it's not the workout itself, right? It's the under-fueling and under-recovering that's the issue. So when I meet with patients, I'm very rarely talking about deloading and training less. I'm more talking about fueling better and recovering better. And so if you think about just like the adrenal glands as a whole, that's so popular right now. Everybody's like, I can't do any cardio at all because I'm going to get into adrenal fatigue. Well, it's not the 30 minutes of cardio you did that got you in adrenal fatigue. It's the amount of intermittent fasting, coffee you're consuming, under calorie deficits, you're not sleeping well, you're staying up too late, right? Like stress is very holistic, and our body doesn't know the difference between emotional stress and physical stress. And I can sit down with my patients and usually identify like 10 to 12 significant stressors on their system. The training's just one of them, right? So training is stress on your system, but if that's the only stress on your system you have, you're not going to overdo it, right? But if there's 11 other significant stressors, you could overdo it, right? So I talk about stress holistically, but what are some like objective markers I look at to like help verify? Now with wearables, there's a lot you can check, but I do look at HRVs. If my patients' HRVs are plummeted and they're very fit, like I do think that they're under recovering, there's something going on. Are they not eating enough carbs to match their exercise? Are they underfueled? Are they not getting good deep sleep? Like if their HRV, if they're a fit person and their HRV is 13, there is something going on. That nervous system is going to get burned out. So I may change their exercise. I might have them incorporate some more yoga and walks and breath work and things on their vagus nerve. So I think an HRV is great. The struggle I've seen with HRV is if somebody's really deconditioned and they just don't have a healthy cardiovascular system, it can be a little bit misleading. So you have to talk through their health, their life, like how much do they get their heart rate up? How physically fit are they? Because if they never, ever, ever exercise and they're sitting all day long and they're not like stressed at work, like they may have a low HRV because they're just deconditioned. So we have to think like holistically on that. But I think it's a great indicator. I'm also really big in both genders, checking pregnenolones, DHEA, and cortisol and leaning in on that. And I think there are certain seasons that call for different things. I always talk about, for me, I have a 6-month-old at home. This season of life is very full. I have a 5-year-old and a 4-year-old. Not the best season for me to do a marathon, right? Like, I love marathon running. Really, I do. It's bad. I think it is probably a little too long of running on your body, but I really love the mental aspect of it. Right now is the worst time for me to do that. I'm not getting good sleep because my infant wakes up all the time. I'm really busy with work. Right now, we just opened 2 new locations. If I decided right now I'm going to spend my Saturday running 20 miles, that is going to get me into burnout, right? But there's a different season of life that I'm going to revisit it. Now, this season of life, I can run that marathon. So I think we live in this space where we're black and white. Like, I'll talk to people and they're like, ooh, like I was overtraining. I was doing 2-a-day training. I was doing half marathon running. My job was super stressful. I was staying up late working every night. I was living on caffeine. And in their mind, I can never do cardio again. And so then I meet with them and I'm like, I don't think it was just the cardio in that season of life that led to burnout. Let's start doing cardio again. Now that you're sleeping better, your stress is lower. So I know that's like a not black and white answer, but I think the more you explore their adrenal function with DHEA, cortisol, pregnenolone, first thing in the morning, the more you know where their HRV is and their deep sleep percent, the more you're able to cater and talk about fueling well and recovering better. And maybe not talk about detraining or like lowering the load, right?
Totally awesome answer. A good consult can pull that out of a person and objective data using your lab tools. It's just the best. So I feel, Kristin, I learned a lot from you today. And I think that both on the practitioner side and the patient side, and practitioners trying to help patients be their best, there's a ton of value here that you shared. So thank you so much for that. Where can people, both practitioner and patient, learn more about you and Stat Wellness and maybe connect with your company?
Yes, thank you. So our website is statwellness.com, STAT wellness.com. We're Stat Wellness on Instagram and Facebook too. My personal page is Kristin Oja. It's Kristin with 2 I's and Oja, OJA.com. And then I'm Kristin Oja DMP on Instagram. I'm on LinkedIn, all the different platforms. And a little plug, if anybody is tired of doing it on their own, let us know, because we are wanting to scale nationwide and we're trying to find like-minded practitioners to join the Stat Wellness movement. There's people that want to do it under their own brand, and there's people that just want to provide really great care and be a part of something bigger, but practice the way they want to. And so if any of the listeners are interested in that, reach out to me. Love to connect.
Yeah, perfect plug. That's the best. Awesome. Well, Kristin, thanks so much for being on Personalized. It was awesome chatting with you. And I hope, for continued growth for you, and you continue to help people live their best lives and be as healthy as possible. It's just so awesome what you're up to.
Thank you so much for having me on.
No problem. Talk soon. Bye-bye.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Dizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.